Smith. My name is Caitlin. I'm going to be your nurse today. I wanted to go over a few things with you first regarding your illnesses and your new medications before you go home this afternoon, okay? So can you verify your full name and date of birth for me?
John W. Smith, April 7th, 1961.
All right, perfect. And I verified that against your arm band and my MAR, and that matches up. All right, Mr. Smith. So first of all, I'd like to go over a few questions with you first. What is your living situation? Do you live alone or with your family or in a nursing home?
With family.
Family, okay. Do you feel like that these illnesses or diseases have limited you in any way?
Not yet, but I can feel it taking over.
Okay. How can you feel it taking over?
In some of my speech, in my walk, in the physical movements of my left arm.
Okay. Do you have an in-home or professional caretaker or supplier?
No.
Okay. And are you compliant with your medication regimens, your doctor's office follow-ups, and any specialized diet needs?
I am with diet and doctor follow-ups, but I don't always take the medicine.
Okay. Well, we'll go over your medications today, and I'll let you know kind of the directions as far as how you need to take those and things like that, and just make sure that you follow that correctly for me. Have you required any emergency room visits or any inpatient hospitalizations recently?
No.
Okay. And do you have a good family and friend support system?
Yes.
Okay, perfect. All right, Mr. Smith. So I was reviewing your chart and I saw where you've been diagnosed with Parkinson's disease and hypertension, which is also known as high blood pressure. So before you leave today, I wanted to discuss a few teaching topics about both of these disease processes with you so that you have a better understanding of them. So let's start off by discussing Parkinson's disease. So Parkinson's disease is caused by a loss of a chemical in your brain called dopamine. And that chemical, dopamine, helps control your movements and your balance. Risk factors for Parkinson's disease include your age, which usually occurs over the age of 40, heredity, which is having a close relative with Parkinson's disease. Men are also more likely to develop Parkinson's disease than women, and exposure to certain toxins, such as manganese, which is a mineral that is found in certain foods. Unfortunately, Parkinson's disease cannot be cured, but there are certain medications and lifestyle changes that can help control your symptoms dramatically. In more advanced cases, though, surgery may be advised. I see here in your chart that Dr. Anderson has prescribed ropinirole 0.25 milligrams once daily to help alleviate your symptoms of Parkinson's disease. So let's discuss a few things about ropinirole. Ropinirole can be taken with or without food. You should take it at the same time each day, preferably 1 to 3 hours before bedtime. Do not crush, chew, or break the tablets. Make sure that you swallow them whole with water. If you accidentally miss a dose, take the missed dose as soon as you remember. Ropinirole can cause some adverse effects, such as your blood pressure may drop when you transition from sitting or lying position to a standing position. So make sure that you always rise slowly to prevent this from occurring. This medication can also cause hallucinations, dizziness, and drowsiness. So you should avoid operating any heavy machinery or driving if you experience any of these symptoms. Parkinson's disease can cause tremors, muscular tension, slow movements, changes in speech pattern, emotional changes, as well as difficulty urinating, and constipation may also occur. With that being said, there are several lifestyle changes that you can make to help cope with these symptoms. They include exercising regularly, eating a healthy diet, staying hydrated, and getting an adequate amount of sleep. What medications are you currently taking right now, Mr. Smith?
Just a multivitamin.
Just a multivitamin, okay. All right, well I have checked and there's no interactions between your multivitamin and ropinirole, so that would be fine as of right now. All right, Mr. Smith, so do you have any questions for me regarding Parkinson's disease, ropinirole, or anything else as of right now?
No, ma'am.
Okay, great. So now let's move on and discuss your other diagnosis, which is high blood pressure. High blood pressure is the most common health problem seen in primary care settings. High blood pressure means that your blood is pumping with more force than normal through your arteries. It's usually diagnosed based off of consistent blood pressure readings that are greater than 140/90. The risk factors for high blood pressure include a family history of high blood pressure, physical inactivity, high cholesterol, smoking, older than 60 years of age, obesity, excessive sodium and/or caffeine intake, excessive alcohol intake, continuous stress, and low potassium, magnesium, or calcium intake, and also kidney disease. If not treated early and effectively, high blood pressure can cause a stroke, heart attack, kidney failure, or even death. Since you are over 60 years of age, the desired blood pressure for you, Mr. Smith, is less than 150/90. Some of the signs and symptoms of high blood pressure include headaches, flushing of the face, dizziness, or fainting. The treatment for high blood pressure consists of different types of medications. I see here in your chart that Dr. Anderson has prescribed lisinopril 10 milligrams once daily to help lower your blood pressure. I would like to discuss some important information with you regarding lisinopril before you begin taking it. Lisinopril can be taken with or without food. Make sure that you drink plenty of water each day while taking this medication. Make sure that you take this medication exactly as prescribed. Lisinopril can cause a dry cough, swelling of the lips, tongue, or face, all of which need to be reported to the healthcare provider if these occur. Monitor your blood pressure carefully every day and do not take this medication if the top number of your blood pressure reading is below 100 without talking to your provider first. So whenever you go to take your blood pressure each day, Mr. Smith, if that top number is below 100, make sure that you call Dr. Anderson's office first and let us know, and do not take the medication without talking to us first. You should avoid foods that are high in potassium, as lisinopril can also cause elevated potassium levels. Like I mentioned earlier with ropinirole, you need to make sure that you rise slowly when changing from a sitting or lying position to a standing position, because both ropinirole and lisinopril can decrease your blood pressure. There are several lifestyle changes that can be made to help decrease blood pressure as well. They include decreasing your sodium intake, losing weight if you're overweight, eating a heart-healthy diet, increasing your physical activity, decreasing your alcohol consumption, smoking cessation, and using relaxation techniques to help reduce your stress. There are no known interactions between lisinopril, ropinirole, or your daily vitamin that you already take at home. Do you have any questions for me before you go home today, Mr. Smith?
No, ma'am.
Okay. Well, if you have any questions or concerns, please do not hesitate to give our office a call. Dr. Anderson has already sent in your prescriptions to the pharmacy, so they should be there once you leave today to go pick them up. I hope that you have a wonderful afternoon, and make sure that you stop by the checkout desk first to schedule your follow-up appointment. Thank you.
Thank you.